A year and 3 months after COVID-19 was declared a pandemic, the global economy is set to make its most robust recovery in 80 years in 2021, according to the World Bank. But that isn't the full picture. The rebound is set to be sharply uneven across the globe. Major economies are expected to see strong growth on the back of fast vaccinations, highly digitalized economies, and massive spending plans. But developing countries without any of these factors are faring weaker than before at below pre-pandemic levels. For them, building back better is an unaffordable luxury. For more on this and how to ensure a more equal recovery across the globe, we connect to David Wilson, Programme Director and Team Leader of COVID-19 and Health Security at the World Bank. Welcome to the show, Dr. Wilson. Thank you so much for joining us today.
Thank you, Siyang.
Well, now, we saw last weekend that G7 leaders, they pledged to donate 1 billion doses of COVID-19 vaccines to developing countries in order to address the severe shortage of supply that they have. But many international organizations, they've criticized this agreement, saying that it's simply not enough. So I was wondering what your take is on this.
Thank you, Siyang. And as we all know, we're in the midst of a global pandemic, and there's unprecedented urgency to secure enough doses for all countries as soon as possible. And in this context, expectations are understandably very high indeed. But it's important to note several points. First, the donation of 1 billion doses that you referred to is in itself an extremely significant step on a scale without parallel. And second, the donated doses aren't the only form of support for global vaccination. Developing partners have formed COVAX as a mechanism to ensure early access for all countries. And COVAX has pledged to provide 20% of vaccine needs free to 92 low and middle income countries worldwide around year end. And third, there are important regional initiatives such as the Africa Union Vaccine Acquisition Task Force, which seeks to secure additional vaccines to enable Africa to vaccinate 60% of its population. And fourth, multilateral development banks, such as the World Bank and the Asian Development Bank, have committed 12 billion and 9 billion respectively for vaccines. And fifth and finally, the IMF has taken the unprecedented step of expanding its lending and enabling countries to use IMF resources for vaccines. Between all these mechanisms, we may be approaching significant financing for vaccines. Our greatest challenge is to collectively accelerate vaccine production so there are enough vaccines for everybody globally as urgently as possible.
Well, over the past year, there have been calls to really fill that funding gap and also try and ramp up production for vaccines in developing countries as well. But even so, according to Oxfam, low-income countries, they're vaccinating at a rate of around 62,000 people a day. And at that rate, it will take them nearly 6 decades to vaccinate their entire population. So, well, when we talk about economic recovery from this pandemic, how would the rate of vaccination in these countries really affect the pace of their recovery?
I think you're absolutely right to highlight that, Siyang, and it's clear that high rates of vaccination are important to enable societies to reopen and to work, trade, and travel with confidence. And we've already seen how high vaccination rates have enabled countries such as Israel, the US, and the UK to increasingly reopen their economies. And unless we can accelerate global vaccine rates, especially in low-income countries, there's a real danger that we'll see a two-speed world, with high-income countries opening, traveling, and trading with confidence, while lower-income countries languish isolated, subject to repeated lockdowns, and with drained business confidence. And that's why all the steps that I spoke about earlier to accelerate vaccine production for all countries are so vital. Vaccines are our only safe pathway to robust global economic recovery, but they have to be shared as equally and urgently as possible.
And well, how hard have developing economies been hit by COVID-19? And they were, of course, trying to really continue down the path to sustainable development. Which sectors do you think suffered the most due to the pandemic?
I think what makes this virus so unique is that only a small proportion of humanity has been infected, but all of us have been affected. And even countries which have had very few COVID cases, such as South Korea, have felt the economic impact of the virus. And as we know, it's caused the greatest economic decline since the Great Depression, nearly a century ago. And developing countries have indeed been hit worse because they have fewer reserves to fall back upon and fewer safety nets for people who have lost livelihoods. Perhaps the hardest hit have been countries which rely particularly on tourism, including islands in the Caribbean, Atlantic, Indian, and Pacific Oceans. In general, manufacturing and agricultural economies have fared better than service economies because it's easier to sustain highly mechanized manufacturing and agriculture with social distancing during COVID.
And well, there's been quite a lot of debate recently over how to get people in developing countries vaccinated as quickly as possible. And well, US President Biden, he's pushing to waive a patent, but some European countries say that's not going to entirely solve the problem. So what's your view on this?
I think my view, and the view of my organization, the World Bank, is that we support all global measures, including TRIPS flexibilities, that enable us to accelerate vaccine production as quickly as we possibly can. And companies such as Moderna have said from the very outset that they would not enforce their patents during this pandemic. And I think the key point is that a focus on patent waivers must be accompanied by technology transfer. There are several hundred discrete steps required to make vaccines, and each of these steps must be executed perfectly to produce safe and effective vaccines. And we already have inspiring examples of technology transfer to note. AstraZeneca, for example, committed to produce its vaccine at no profit at approximately $3 a dose during the pandemic phase, and has actively pursued technology transfer, supporting over a dozen production facilities globally on nearly all continents. And South Korea's SK Bioscience was the first company in the world to receive a World Health Organization emergency use license for licensed production of a vaccine, the AstraZeneca vaccine. And South Korea will play a major role in expanding global vaccine production. SK Bioscience already produces both AstraZeneca and the very promising Novavax vaccine, which just released its US and Mexico phase 3 results. And the country clearly has the capacity to expand vaccine production further. The key point is we have to use all channels to accelerate vaccine production, including investment in expanded production, including technology transfer, including donated doses and financing for countries to buy vaccines and to implement vaccine programs. And for example, the World Bank's private sector arm, the International Finance Corporation, is investing in doubling production of the Johnson & Johnson single-dose vaccine through technology transfer in Aspen, South Africa. So we have to seize every opportunity to accelerate vaccine production.
And well, per capita income in many emerging markets and developing economies, they're expected to remain below pre-pandemic levels, and the losses they're set to worsen deprivations associated with health, education, and living standards. So, what kind of support do you think countries need in order to be able to build back better as well? And also, how has the World Bank been helping them stabilize their situations?
Yes, we at the World Bank are acutely aware that the pandemic has caused unprecedented damage to livelihoods and to human capital growth. And we have committed over $160 billion to support countries to recover from the COVID crisis. And this financing is very broad and ranges from maintaining essential health, education, and social protection services to supporting countries with their economic recovery. And we've also taken the unprecedented step of seeking an early replenishment of our main mechanism to support low-income countries, the International Development Association, which means we will disburse 3 years of funding in 2 years to increase the amount of funding immediately available for the COVID recovery. And we'll start the next phase of our International Development Association called IDA 20 1 year early. So we are using all the capital at our disposal, and we're also seeking an earlier replenishment to ensure that we have additional capital for developing countries as soon as possible.
And how do you think developed, more advanced economies can really help these countries also build the infrastructure needed to make their development sustainable in the long run?
I think that the one point that I would highlight is one that we touched on together at the beginning of our conversation, Suyang, and that's the incredibly important role that equal global access will play in allowing countries to recover faster. And we do have to restore a connected world with trade, travel, and business confidence in which developed and developing countries can interact freely. And we all have a part to play here, as I've already discussed. High-income countries can expand manufacturing, can transfer technology, can donate doses, and can finance both COVAX and the multilateral development banks, such as the World Bank and the Asian Development Bank, to expand vaccine production. Low-income countries can lead with political will, turning doses into vaccines in arms as quickly as possible. And I think we all watched amazed and impressed as tiny little Bhutan, the mountain kingdom of Bhutan, leapt to the top of the global vaccination tables, vaccinating its entire adult population within a single week. And global vaccine hesitancy is a challenge that all countries have to address. The more countries succeed, the easier it becomes to overcome hesitancy in other countries. And as global citizens, we can each play our role, taking vaccines when our turn comes, and engaging with understanding and support those who are hesitant. Vaccinating the world is the best pathway to return to a normal world. Once vaccinations enable us to resume newer life and normal life, we can focus on green recovery, on building a greener, more inclusive development beyond COVID. But until we have vaccinated the world, we're not going to be able to do that fully.
And of course, in a lot of developing economies, most of the workers there, they're employed in the informal sector, and the pandemic's obviously hit them very profoundly. How would governments in those countries have to really help those people who have lost their livelihoods due to this pandemic?
Thank you. The World Bank has argued for many years that we need to build health and education insurance programs and social protection programs that are not linked to formal employment. So we have a big focus in our health insurance programs, in our social protection programs, on mechanisms to provide grants and support to people in the informal sector. And I think you're right. This pandemic has accelerated a move towards informality. But it's also worth noting that we at the World Bank have also seen the fastest growth in social protection measures globally since we began monitoring. And the majority of those measures do reach people in the informal sector. So it's an immense challenge, but we are starting to respond to it better.
So it won't be easy building back better, but it will certainly be better in many levels. And well, I'm afraid this is where we'll have to wrap up the interview today. But that was David Wilson, Programme Director and Team Leader of COVID-19 and Health Security at the World Bank. Thank you so much for joining us today.
Thank you for having me, Suyang. Good night.
And to our viewers, as always, thank you very much for watching.